Hi, my name is Belynda Abbott, and my pitch is around clinical supervision. According to the Australian Clinical Supervision Association, it is seen as a clinical, focused and formal professional relationship that identifies learning needs, facilitates reflective practice, develops skills and explores ethical issues. There is a plethora of literature around the impact clinical supervision has around reflective practice and learning needs and its impact on work environments, particularly within mental health. Very little research is identified for acute care nurses, which is probably due to the misunderstanding and lack of knowledge around clinical supervision in other healthcare environments. It is often misconstrued with performance management or management supervision. There is also a misconception that it is a burden on time and resources, when research has identified that it actually assists with staffing shortages and retention on nursing staff. The research question that I want to ask is for acute care nurses: what is the effect of clinical supervision on sick leave percentages compared with acute care nurses without clinical supervision? I want to undertake a randomised controlled trial accessing at least 4 large Australian acute care hospitals and targeting acute care wards with a similar cohort of patients using a mixed method approach. I would need to ensure that these areas have not been exposed to clinical supervision before. The intervention group would be exposed to a 6-monthly trial of group clinical supervision with an external trained supervisor. I want to utilise the Manchester Clinical Supervision Scale, an internationally validated tool to measure the effectiveness of clinical supervision, and in addition I will also collect data from the business planning framework around sick leave costs and percentages. The main reason why this research is important is due to the looming nurse shortages, increasing staff turnover rates and the cost of sick leave within a healthcare environment. And as a result of an ageing population, technology and the rise in comorbidities, the nurse's ability to provide compassionate, safe and competent care is being compromised. Hence why we need an intervention like clinical supervision. The literature around the successful implementation of clinical supervision has remained patchy both internationally and within Australia. The literature around the implementation of clinical supervision has a positive effect on culture, engaged, motivated and supported nurses, and varied results around retention and absence or sick leave rates. My research project will add new knowledge around the implementation of clinical supervision within an acute care environment and its impact on sick leave within an already burdened acute care system. The results from the research project will add to the economic and cultural impact within the acute care environment. This in turn will benefit the acute care system, nurses and other healthcare professionals in receipt of the effects of clinical supervision, the unit culture and ultimately patient outcomes. Thank you for listening.